What brings you in today?
I am really thirsty, peeing a lot, and my stomach hurts.
Alright, I will need a sample of urine to determine what is going on. Could you pee into a specimen cup? Based on the signs and symptoms and the fact that the patient has type 1 diabetes, I have a feeling this could be diabetic ketoacidosis.
What is diabetic ketoacidosis?
Over time, as type 1 diabetes worsens and less insulin is able to be produced, the body cannot keep up with energy demands, causing an imbalance. The body is then placed into a state of stress requiring even more energy. The imbalance increases and the body can no longer compensate, and that leads to diabetic ketoacidosis. The body goes into a state of starvation and burns fat for energy, producing ketones.
There were elevated levels of ketones in your urine. Ketones are chemicals the body produces when it breaks down fat for energy. Your diabetes is out of control and needs to be managed.
Nursing student Brian, what do you think we will do to assess and intervene with this patient?
Fluid replacement therapy?
Correct. Fluid replacement is one of the most important interventions. We will infuse 0.9% normal saline, which will restore extracellular fluid, lower blood glucose levels, and decrease counter-regulatory hormones. Can you think of what comes next?
Insulin, maybe?
Good answer. Do you know how insulin works?
It inhibits lipolysis and ketone production, which promotes regeneration of bicarbonate. Ketones cause blood to become acidic and, regenerating bicarbonate will increase the pH level.
Did you know that CBG levels can get as high as 30 millimoles per liter or more?
We will implement insulin therapy by using short-acting insulin starting at 0.15 unit per kilogram bolus. This will cause sugars to go into the tissues and lower the CBG levels.
Insulin therapy causes extracellular fluid electrolyte concentrations to decrease.
During rehydration and insulin therapies, the serum potassium and phosphate concentrations declines rapidly as they re-enter the intracellular compartment.
This is corrected by replenishing electrolytes by intravenous therapy. Just remember, if we rehydrate too quickly, this could cause cerebral edema, which often leads to death.
We caught it just in time, as diabetic ketoacidosis can cause organ failure, diabetic coma, and be fatal. He should be fine, however, this could have been prevented.
Brian, do you remember key diabetes management?
It is important to test your blood sugar periodically throughout the day. Use short-acting insulin at meals, and long-acting to last the day.
There are some other tests to be done. Do you know what they are, Brian?
Urinary ketone testing and accurate carb counts.
Excellent. These are all important diabetes management tips to keep in mind. Now that the patient is stable, you can health teach before discharge. Wonderful work in there, Brian. Let's talk more about diabetic ketoacidosis. Do you know what other causes there are?
Heart attack?
Correct.
Wow.
Yes. Traumas, such as heart attack and stroke, as well as illnesses like UTIs and pneumonia, can lead to insulin deficiency.
I know that when a person is ill, proper insulin management and CBG monitoring become even more important, since health status is more likely to change.
I am very impressed. Even in a healthy state, one missed dose can lead to fast metabolism and increased ketone levels.
Did you know that sometimes people can develop sweet and fruity breath, or may even smell like nail polish remover, when blood glucose levels are high?
Wow! Thanks, Dr. Joey. You are so smart.
Thank you, Brian, for the health teaching. I will use that information to stay on top of my diabetes. Hopefully you will not be seeing me again.
You are very welcome. Good luck.
As a team, we were able to stabilize the patient using key nursing interventions.
Until next time, study hard.